This 5-year-old female underwent an endoscopic puncture of her right ureterocoel. After this procedure, a VCUG identified grade 5 vesicoureteral reflux. At the age of 19 months, she underwent a cross-trigonal ureteral reimplantation in order to correct the reflux. However, following the discontinuation of her prophylactic antibiotics, she began having recurrent urinary tract infections. The patient was then presented to us, and we performed the following VCUG, which showed persisting right-sided grade 5 reflux into the lower moiety. We decided to try and correct her reflux with an endoscopic injection of dextranamir and hyaluronic acid, commercially known as deflux. Due to the cross-trigonal reimplant, the axis of the ureter was nearly perpendicular to the axis of the urethra, hindering the entrance of the cystoscope. Thus, to gain access to the ureter, a 4 French whistle-tip catheter was used. The catheter was inserted into the ureter in order to align the two axes as shown. Its position was confirmed by X-ray. This maneuver reduced the ureter angulations, and the catheter was then replaced with the injection needle. 4 injections were performed in the intramural part of the ureter. The first is shown here. The mucosa did not elevate due to the previous surgery. The second injection was then used to supplement the first. The relative position of the third injection is shown here. A fourth injection was then placed near the previous one. A fifth mound was then created at the ureteric orifice. A sixth subureteric injection was made beneath and perpendicular to the ureter. This deflux injection pushed the bottom of the ureter toward its ceiling, effectively occluding the tunnel. At the end of the procedure, we had a long and narrow submucosal ureteric tunnel with a slit-like, non-hydrodistendable orifice. A VCUG performed 3 months after the procedure confirmed its success. The patient was then taken off of the antibiotic prophylaxis and did not experience any more urinary tract infections through a 24-month follow-up.